All right. Well, we tend to try and start these things a minute past the hour. There may be a few stragglers joining us, but let's go ahead and get started. Thank you to all of you who have taken the time today out of your busy schedule to join us today as we cover our latest interesting topic in this ServiceNow webinar series of ours. Today, we're going to be focusing on the future of healthcare in contact centers, and specifically how you can bring together voice AI and workflow in ServiceNow. A couple quick housekeeping items to get things started. As a reminder, some of which what we might cover could be forward-looking in nature. We simply ask that you take that under advisement. But we have a packed agenda for you guys. First and foremost, we're going to do a quick round of introductions so you know who your presenters are, before diving into just some statistics, some talking points in terms of what are the trends and challenges in healthcare today. And then we're going to take a look and discuss how 3C Logic and ServiceNow, specifically ServiceNow HCLS, so healthcare and life sciences, can come together and presumably help address some of those hurdles. And then, of course, usually what everyone is most interested in is a live demonstration. So we will do one for you guys today. Always a little bit risky to do live demonstrations, but that's the way we do it here at 3C Logic. And then, time allowing, we'll finish with some key takeaways, and if possible, try and tackle any questions that you in the audience may have. So with that, allow me to kickstart things by just a quick round of introductions. For those of you who don't know me from prior sessions, my name is Guillaume, G for short. I am the ServiceNow practice lead here. I am joined by my counterpart and colleague, Josh Klein, who is one of 3C Logic's senior solution engineers. And our guest speaker is none other Jasmine Hodges, who is an advisory solution consultant with our strategic partner, ServiceNow. Jasmine, thanks for joining us.
Yeah, thanks for having me. Hi, everyone. So I cover everything from an HCLS perspective, all things CRM. I also come from a very deep technical background. I've implemented ServiceNow for multiple different customers, and I've seen real time what it can do. So please feel free to, as we go through the demonstration and the presentation, ask those questions. Happy to address them, and really excited to get going.
Yeah, excellent. All right. Well, in the spirit of getting things going, let's do that, right? So for those of you who are familiar with some of the sessions we've done in the past, we always like to sort of anchor the conversation with a few statistics to sort of get an idea of what is it that we're talking about today? Why does it matter? What are the challenges that hopefully by the end of the session you will discover can be solved together with the help of 3C Logic and ServiceNow? And when it comes to healthcare, perhaps one of the most glaring ones that I was able to find here with our team is one from very recent from Forrester. And interestingly enough, what they've uncovered is that despite the fact that in healthcare, millions of dollars have been spent on digital experiences to drive ideally self-service, the adoption, unfortunately, has been lower than what the providers, had hoped. And ultimately, what we're seeing is not a reduction in the number of calls, but actually an increase in call volume to health insurers and providers. And the expectation is very likely it's going to continue to soar. And so interestingly, while voice traditionally has always been that channel that everyone loves to hate, right? Typically, when you call an organization, it's not because you want to give them a high five and tell them good job. It's usually because you have a need, usually pressing. And in healthcare, I would imagine sometimes even life-threatening. The fact is that voice still dominates in healthcare support, but it has its challenges. Very often the contact center is siloed from where the information resides to drive personalized engagements. There are compliance, policies and regulations that also make the customer experiences sometimes difficult to provide. And all of that leads to a very inefficient process and outcomes. But interestingly, when you consider voice as an engagement channel, is currently customer engagement as a whole is currently going through a shift, and very likely voice as a form of engagement is going to be at the center of where things are headed. So if you look at the chart in front of you, we've evolved substantially from the old, days of switchboards. And those have since evolved to, IVRs, workflows, which I'm sure most of you are very familiar with if you operate in a contact center today. And then there's been the, proliferation and evangelism around multi-channel. And now you fast forward and AI has substantially changed the game. What you see now with voice AI is an opportunity to really actually deliver the experiences that you would hope or would have expected to have in years past. So instead of going through those deterministic press one, press two experiences, voice AI, natural language processing is actually now largely creating a future where there's going to be a new era of customer engagement, where voice, could conceivably become the predominant form of engagement with organizations, healthcare being no exception. And if you look at the data, the majority of organizations, majority of consumers for that matter, want companies to adopt advanced voice AI technologies. But again, even if you solve for the contact center, even if you solve for the engagement layer and provide those conversational, human-like experiences, that's really only half the battle, right? And so this is as good a time as any to bring in Jasmine to talk about why is customer experience, so painful. Jasmine? Oh, you're on mute.
Talking to myself on mute. Awesome. Thanks, Jay. Appreciate that. So yeah, as mentioned, here at ServiceNow, this is what we like to call our messy middle slide. So first and foremost, as mentioned, from a member perspective, the challenges that come with that, G kind of covered most of those, but then we actually transfer to the contact center and the agent. The call's transferred to them. They have to repeat different things. They don't have access to the full collection of information to inform them on how to handle either a member claim or benefit information or answer their question. And they're spending most of their time navigating through different systems, even through post-it notes, instead of actually focusing on the service that they're providing to this member, right? And then it gets even more painful when we take it to the middle and back office departments. Not only is there a lack of visibility, there's a lack of communication, there's a lack of accountability to know who is responsible for what task as a part of what process, especially as we get into much more complex processes like claim disputes, claims management. A lot of those, it's really, poor visibility, poor cross-function, and just a lack of overall coordination that leads to a poor experience, missed SLAs, potential financial penalties or compliance risks.
Yeah. So ultimately, at the end of the day, even if you have perfected the engagement layer, right, as an intake, if ultimately ends up in a black box, right, then you find yourself in that experience that we're all too familiar with, right? You've made a request and then you're not sure where it went. Or the agent that's receiving the call doesn't have ready access to the information to, solve the inquiry. And so really what you have is a need to bring together, presumably not just the contact center portion, but also the CRM portion, right? In this case, ServiceNow and healthcare and life sciences. So if we drill down into that a little bit deeper, Jasmine, let's talk through a little bit of specifically some of the key challenges that you in your experience have found a lot of healthcare operations typically struggle with. Can you walk us through a few of them?
Yeah, absolutely. So first and foremost, we have the rising call volumes, and this is where agents are spending too much time with each of their calls. They're struggling through manually entering notes. It's a very, error-prone, high human touch process, and it's extremely time-consuming. So if we step into the next piece, we also have provider and member friction. And this is where, the provider perhaps is, submitting or chasing down information in terms of the status of a prior authorization. The member in turn is also confused about their billing. And these experiences, again, span multiple systems, multiple different middle and back office. And that back and forth is not only frustrating for the person who is on that end, but also for the agent who's trying to help and just lacks visibility, plain and simple, into the information they need to address the provider, member, or patient's problem. Next, we have compliance and audit regulations. These are always going to be top of mind for these organizations. This is making sure that every word that's said, every action that's taken, every conversation that happens is stored and retrieved for audits, and not just from an external perspective, but also internal too. So making sure that, with these high stakes of, compliance and audit regulations, we want to make sure that we're not stuck, having to document calls or document interactions, both within the organization or external to members or providers, and rather focus on, again, that member experience and improving that as well. And then finally, we have the agent burnout and inefficiency. As you can see, all of these things that we just mentioned sort of lead to, a lack of ability to complete repetitive tasks, lack of context. And, this not only, again, provides a very frustrating experience on the external for the member provider, but also for the agents. If you don't actually have the information that you need and you have to go into, 5 different systems to get the context in order to answer a simple question or a call and find the status of, a dispute or, a claim itself, that's really challenging, and it tends to lead to burnout because of this inefficiency.
All right. So we've talked about, and I agree with all of these points, right? These are, points that have been around for a while and yet, frustratingly remain. We've talked about, one, the contact center piece, important form of engagement intake. Then you've got obviously the operational workflows that are supposed to obviously solve the inquiry that's being made. And we've tackled some of those challenges. So if in a nutshell, you were sort of to explain what will be the alternative. If you solve for these things and bring together CRM, contact center, voice capabilities into one seamless experience, walk us through why that might be transformational, Jasmine.
Absolutely. Yes. So for the solution between 3C Logic and ServiceNow, first and foremost, from a member experience perspective, members are able to come in, they're able to self-serve, and they're able to have a truly conversational human-like experience. In this case, the agent can sort of have their own personality. They can quickly find the status of a claim or of a prior auth. They can confirm benefits or for providers in network. So again, those repetitive questions, repetitive tasks, and getting a very simple answer with a human-like experience. And then even more so, if we need to take that even further, the voice AI agent can actually create a case, which we'll cover in the live demonstration as well. And then from that point, transitioning to the agent experience itself, with the goal being to resolve a request or issue via self-service to deflect calls. There may be times that a member actually does need to speak to an agent. And so in these cases, the call and or the case is going to be automatically routed to the right agent based on their skill set, their location, their availability, and even the live context that we can determine from the call as well. From this point, the agent is able to have a single pane of glass. They have all the relevant data, all the relevant historical information. This could be anything from benefits to prescriptions to claims to prior interactions. And the agent never has to swivel chair to other systems in order to get this context and visibility, and is able to communicate these things in real time. And then from the next best step, if there's additional resolutions or say emails or chat replies that need to happen, we're also providing additional capabilities and additional tools to make sure that the agent is able to stay focused on the member and not having to navigate systems or, summarizing post-call, post-it notes and write notes at the same time as well. So they're able to get what they need. And then even further, again, if we need to take these to a much more complex process, maybe it's not just a simple question or inquiry or requesting of status, we have access to the middle and back office, and we're actually orchestrating and facilitating workflow throughout this process. So, 30% of roughly of these contact center, inquiries need additional work from middle and back office. That could be claims disputes, that could be UN review, that could be payment integrity, that could also be compliance and regulations. And so in those cases, making sure that all the way from the engagement layer to the middle office, we're able to automate and orchestrate that work, prioritize routing to the correct specialist, the correct department. We're not having a ton of reassignment that causes additional friction and additional time consumption on an already time-sensitive workflow in most cases. And we're able to match based on skills and the caseload that's available. And then in turn, providing that end-to-end visibility all the way back to the member. So we're still meeting status of SLAs, and we're still providing that level of visibility to all individuals that are involved through the process.
That's it. That's all, Jasmine. That's
Quite simply.
quite simply. Well, all right. So, but the point is that you get to check off a lot of boxes, and what we're doing is most likely solving a lot of small issues in, if you look at them individually, but in their aggregate add up to an enormous amount of challenges, right? That impact speed of resolution, impact the experience for the caller, impact the experience for the agent who ultimately just wants to help, all the way through to all the back end processes that, presumably if they're not working in sync, are just going to create delays, frustration. And let's be honest, when people are frustrated, what do? They call back. And so that also contributes to additional call volume. So if you can do things right on their first try, these can all add up to substantial benefits that can have an impact on operations in terms of cost, impact on speed of service. We talked about agent burnout and so forth. But again, we don't want everyone to take our word for it. And we're probably not going to be able to show everything you just highlighted in one single demo. But our counterpart here, Josh, did prepare a demonstration. Josh, for the sake of our audience, before we just dive in, why don't you give some context of what you've prepared, and then we'll dive into the demonstration itself.
Yeah, absolutely. Thanks, G. So we're going to get to see a full end-to-end experience of what it looks like to interact with ServiceNow by way of 3C Logic and our voice AI agents. So what that's going to look like is we are going to have a provider or practitioner, Jason, call in on behalf of a patient and receive an update through our voice AI agents that are able to deliver these about a request, a pre-authorization request for a medical procedure. Now, the voice AI agent is going to be able to dip into ServiceNow and provide details about that pre-authorization request, right? Was it approved or denied? What are the reasons why? Really trying to promote self-service as much as possible, right? What information can we give Jason as he calls in about this update for Jessica? So all of that can be retrieved from ServiceNow in real time. We're fully automating that process of retrieval. And on top of that, if there's an update that needs to be given, maybe a dispute that needs to be processed, we're able to process those details right back into ServiceNow as well. So whether it's a claim dispute, a case, any sort of ticket that needs to be processed, we're able to do that from those voice AI agents on the front line and put that information right back into ServiceNow, which of course from there, once we have the transcription, the interaction, the claim, all of that information can now be processed and workflowed further from ServiceNow in the ways that you know and are familiar with, that Jasmine's also going to go over as well. So that's kind of the demonstration that we'll go over in a nutshell. And I'm excited to go through it with you guys.
All right. Well, you've teed it up nicely. Without further ado, allow me to stop sharing my screen. And Josh, I will turn it over to you.
Perfect. Let me go ahead and make sure I am sharing the right screen here. And hopefully we can see that okay. All right. G, everyone able to see my screen all right? Perfect. Cool. So let's get into it. So, like I mentioned, we're going to be using the 3C Logic Voice AI Hub to power this demonstration today. So, this hub is able to be fully embedded within ServiceNow. So, as an admin, as a supervisor, whoever needs to create or make changes to these AI agents can easily do so without leaving the environment. Now, to start with here, we're looking at the homepage, right, where we can see what agents are currently being used, what that usage looks like, but we might want to drill down further into the actual creation of these agents. So as I click into our list of AI agents, the one we're going to focus on today is our healthcare assistant. So I'm going to go through how these agents are created at a very high level, and then we'll actually get to hear what this experience sounds like using these agents. So this is Holly that we've created here. As you can see, it's really pretty simple to set these agents up, and the complexity for how they operate is really up to you. Now, to start with, we've given Holly a title and a name, so we can refer to her. We've also given Holly a job description, right? These are the tasks that Holly is meant to complete to start with, right? We've told her that she's an agent working for a large healthcare organization, and that folks are going to be calling in to receive updates about pre-authorization requests, among others. So providers, practitioners calling in can hear those updates. We've tasked her with finding that information in ServiceNow and pulling it forward to create a pleasant experience when folks call in to receive those updates. We've also given her the ability and told her how to create a claim dispute if someone has a problem with information they've received about that pre-authorization request. And we've told her what data and information to gather when creating that dispute, and kind of the guidelines that surround that. We're also going to give her a greeting, an end message, and some guardrails as well. And guardrails, as most people know at this point, are a very important function within AI, making sure that we're staying within the boundaries of what that AI agent is being tasked with, right? Important things like making sure that the agent is only following the instructions that they've been given from you and not searching the web for other results and answers, making sure that if they are provided with a repository of sensitive information that might be a security breach if leaked, that it's only using that sensitive information to take care of the tasks that it's been assigned and to not use that information in any other setting. So guardrails are very important, and we're able to make sure that we can go in and set up and create those guardrails however we'd like. So again, everything in this AI hub is very configurable. You can make these changes to ensure that these agents reflect the tasks that you want to create for them. And of course, in this scenario here, we're going over that very repetitive task of not only data dipping into ServiceNow to gather information about what a provider or practitioner might be calling in about, but also creating a case back in ServiceNow, such as a claim dispute, to be able to log that information as well. And the last thing I wanted to go over is the voices that we're able to empower these agents with. These are going to be much more natural sounding than anything else that we're used to and anything that we've heard in the industry in the last decade or so. So we will hear how natural sounding they are, how they don't sound like robots like they typically have, and how pleasant the experience really is. And we mentioned the phrase "human-like" before. It really is a pretty tough to distinguish there. So let's go ahead and actually hear what it sounds like to try this agent out. I'm going to go ahead and click this try it out button, and we're going to simulate a phone call coming through from a provider. Now, when I say simulate, I don't in any way mean that this has been staged. I simply mean that we're going to do it through my computer instead of through my phone, just so you get a nice clean output and you can see a full transcription happening on the screen in real time. So being able to see my response versus what the AI agent is responding to me with. And we'll hear that entire experience end to end. I'll pick it up at the end to show you how all of this information gets created back into ServiceNow. Before I do call in, I do want to click over into our ServiceNow environment and show you that this is the pre-authorization request form that we are going to be inquiring about today. So, of course, us as the audience know all of these details here. We can see that it's Jason as the referring practitioner. That's who we're going to be calling in as. We're calling about this request that involves Jessica Jones, and it is pre-authorization request 1049. After giving that number, it's going to look up that pre-auth request in this table and be able to pinpoint all of the details that I need to hear about the missing key information. So again, as the audience, we understand that we have this information right here, but a caller is not going to have the full ServiceNow environment open in front of them. So to be able to hear all of this just by inputting their pre-auth number and potentially an NPI number, right, from their provider or practitioner information, we'll be able to hear all of that. So let's go ahead and call in and get some details about that pre-auth request. Let me make sure I'm showing my sound as well. And there we go. Hello.
Hello. Thank you for calling the Healthcare Help Desk. My name is Holly. How can I help you today?
Hi, Holly. I'm calling for an update on a pre-authorization request on behalf of Jessica Jones.
Thank you for that information. Could you please provide me with your NPI number?
Sure, that's NP661411.
Thank you. Now, could you please provide the last 4 digits of the pre-authorization request number?
Yes, it is 1049.
The pre-authorization request number is PAUTH00001049. The status of the request is denied. The short description states, missing key information, and the reason for denial is unable to approve coverage of procedure without primary reason. Is there anything else I can assist you with regarding this request?
Could I actually create a dispute for this, please?
Of course. I will need a few details to create the claim dispute. First, could you please provide the requested procedure?
Yes, this is for an atypical knee surgery.
Thank you. Now, could you please provide the reason for the dispute?
The reason is that it is medically necessary for this procedure to take place.
Your claim dispute has been successfully created. The claim dispute number is CD00200022. Is there anything else I can assist you with today?
No, thank you. That's all.
Thank you for calling. Have a great day.
Great. So we can go ahead and hang up there. A few things that I want to point out. The first is that we are able to get our claim dispute back immediately. So I know what number that is. In just a moment, we'll go over to ServiceNow and see where that lives. But also that I was able to receive all of that information very easily. We heard it very clearly over the phone, and it referred directly to this pre-authorization request. So I was able to validate myself with that NPI number. I was able to look up that pre-auth with the exact last 4 digits, and I was able to hear all of that information very easily. So very easy for that voice AI agent to facilitate that experience. And of course, once I recited some information back about that procedure that we want to create a claim dispute for, I simply go into my claim dispute table, and here I have a medically necessary claim dispute here for an atypical knee surgery. It's a medically necessary appeal. I have the pre-authorization request that it's related to. So all of this information, including a short description and my member here, is all going to be available directly within that claim dispute case. So from here, I'm going to go ahead and pass it off to Jasmine for her to walk you through some of the other workflows that you can accomplish by now having this information in your ServiceNow environment.
Awesome. Thank you, Josh. Appreciate that. Let me go ahead and take over screen sharing. So now, if you'll just confirm for me, that's the right screen. Awesome. So now we'll take a look at this from the lens of, okay, this claim dispute has been submitted. This is a pretty complex process that typically, there's multiple different respective groups, again, that middle and back office, and even potentially external groups that could be included as a part of this process. And now we need to bring together a disparate process into one single system here. And so we'll walk through the fulfillment of what this claim dispute looks like and cover a couple different capabilities that can support that process as well. So first and foremost, we're looking at a claim dispute record. The first thing that we're looking at here is what we refer to in ServiceNow as our playbooks. And what our playbooks are, I typically like to refer to them as sort of a visual workflow. And the reason why I say that is, we can see very visually all the different steps that we'll walk through, whether or not this may be the responsibility of the individual or the persona that I'm operating in. These may go to different business groups throughout the organization or external entities, but I still have visibility throughout the entire process into the workflow this actually needs to go through. So you could see that we actually had a first step here upon that creation, and that was what was populated by the voice AI is, categorizing this claim dispute. So we can see that this is tied to Jessica Jones. This is that medical necessity appeal for that atypical knee surgery. And before we jump in, a couple things that I do want to call out as well is behind all of what you're seeing here, we actually have what we refer to as data models. And one of those being the HCLS data model. And the reason why I call that out is if we open up, say quickly, Jessica Jones member record here, we really get a full 360 view in order to be able to have visibility into the details around Jessica Jones. So we can see comprehensively, again, as mentioned earlier in the presentation, we can see who she is. We can see if she's got any, conditions, medications tied to her, existing, cases that may exist, her insurance details, all of those different details that may be important to inform us throughout the process here. On top of that, we can also take a look at the pre-authorization request as well to get additional contextual information. So we can take a look and we can see the details. We can see that it was denied, what it was for. Again, we can see the insurance as well. If there's any clinical notes, we can even open these up as well and see some of the details here in terms of past, medical history and view some of those details as well as a part of the process so that we have full information around what decisions were made, what things were denied and approved, and just have full visibility there as well. And here within what we call our agent workspace, I can actually keep those records open throughout the process if I'd like, so I can fully inform, as I'm starting to, do my research and make different decisions throughout the process, I can keep those open and have visibility into those as well. We're going to do a quick, before we step into the expediting itself, we're going to do a quick side tour here. And we're actually going to go into, looks like it may not have opened for me. This is the risks of the live demonstration here. I'm going to open one more claim dispute just to demonstrate this quickly. Because we did receive that letter that came in for the claims appeal. Bear with me. All right, give me just one moment. And I'm going to have a task here where we're actually going to be able to take a look at that claims appeal record. Oh, it doesn't want to present for me. All right, we'll go ahead and skip over that. But we do have a capability here within ServiceNow where we have what we refer to as document intelligence, and that's our native OCR capability. We also pair that with Now Assist to be able to come together and analyze details around, say, an appeals document that would be submitted along with this request as well. We can utilize this, we'll see throughout the process with any other documentation also. And this is where we have the ability to sort of analyze some of the details here. We can automatically analyze the tone for urgency to determine whether or not we need to expedite this appeal or not. For the sake of the demonstration, we're just going to go ahead and say yes automatically. We're going to add some work notes here and say that the tone of the appeal document is that this requires urgent expedition, and we can go ahead and mark that as complete. Now, as we move forward here, we'll be able to continue into the research tasks. Typically, these are associated to the nurse practitioner who is able to take a look here, the initial RN review, and we're able to take a look at the instructions. We can see some of the details automatically pulled forward from the pre-authorization request, and we can see the denial code. We can start to see the patient name and different details that are relevant here as well. I can mark that initial instruction as complete and move forward to my first clinical review task. So we have that automatically generated. It's going to present that to me here, and I can start to take a look at some of the details as well. So as I start to do my research, I can see, okay, here's, I saw the initial instruction here of the pre-authorization. I can do some of my initial research here. I can also even add an additional task here. So if I wanted to say, expand all stages, I should be able to, as part of my clinical review. So say if I needed additional information here, maybe I, needed to request additional information from the provider, I would be able to do so and add some of those details in here as well. I'd be able to also add into this description, if I fast forward the story a little bit, that, ultimately, as I gather some of these details and I do some of my research, I'd be able to suggest denial for a reason. So we're kind of upholding the initial decision based off of the clinical review task here. From this point, I can go ahead and mark that complete. Now this is going to go ahead and go to the medical director to determine whether to, uphold the denial and take the recommendation of the RN or, do some additional research here. So what I'd have the ability to do is open up our Now Assist. And this is as the medical director, I'm still making my own decisions. I'm still informing myself of the additional details here. Oh, let me start a new one here. I'm going to start a new chat here. So I'm still making my own decisions, but I just still need to, get some additional research done on this appeal very quickly. So you can see here within our Now Assist, this is our AI capability. There's additional capabilities that we have here where I can create a data visualization. I can generate knowledge articles. We have a plethora of out-of-the-box capabilities that you can utilize here as well. But in this case, I'm going to go ahead and prompt it to research this appeal. From this point, it's going to analyze that request and it's going to pull forward that capability within Now Assist to be able to provide additional information to help me kind of figure out what my redetermination of this is. Yes, I would like to research. Yes. All right, so it's executed that skill and it's going to let me know that the prior auth is denied. The reason specifically for that being is that the member is over 18, yes, but 3 generics tried in the last 24 months is no, and the treatment plan is active within the past 24 months is no. So again, as the medical director, I'm not necessarily utilizing this to, just make the direct decision for me. This is just to further inform me of additional research on the prior auth, and I can then determine what I want my, redetermination to be. If I want to uphold this or if I want to, reverse this and actually have this be overturned. But in this case, I'll go ahead and actually mark this as upheld, and I will be able to take the recommendation of the RN, and I will go ahead and mark that as complete. Now, the next follow-on tasks are systematic. So they're actually going to automatically take templates that we have within the system, again, via that document intelligence, and it's going to send that member a notification as well as the provider of what the decision was around whether or not that a decision was upheld. In this case, it was upheld, so it will continue to be denied. So we're going to go ahead and send those to the respective parties via automated notification here. And then in the next section, we move forward to forwarding to the IRE. So this is kind of continuing in the decision-making process. Because we've upheld this decision, we now need to go ahead and move forward throughout that process. And so this first step here is actually for collecting documentation. And what this is intended to represent is actually digitizing forms or what are typically paper documents in a dynamic fashion here. So I can actually start to populate some of these details, and I can say, hey, I want to populate medical part B. What parts am I representing? The medical beneficiary or the provider or supplier? I'd be able to populate some of those details here, and dynamically, depending on what I select, other fields may or may not show. So I can populate some additional information here for us to be able to populate here. But in this case, I'll just go ahead and select these. Am I submitting evidence? I'll say I am not planning on submitting evidence at this time, and I can go ahead and mark this as complete. From this point, it will generate the task for the independent review. So this is just making sure that, this gets reviewed to IRE. And in this case, we know that, IRE is an external entity. So they wouldn't necessarily be operating within ServiceNow, but because we have the option to send, this letter via attachments and via utilizing document intelligence, we would actually be able to still ingest and populate all of the information that they come back to us for. So they may or may not, email or call or, send us, a letter back where we can actually read the details and populate the redetermination to determine if it was upheld or overturned and follow due process as associated to that. So all of that information, all of that activity, regardless of it being an external entity, still gets funneled back to this original claim dispute. So we have full visibility and information on that and can take the next steps according to what happens through this process. In this case, I could actually mark this as, say, IRE comes back as overturned. I'd be able to mark that as complete. And then we move on to the last step of effectuating. So in this case, this is where, because we've marked this as complete, it's going to actually have us review the determination. So we can see again, here was the initial clinical review, and we can see that that was originally upheld. But in this case, it was actually overturned when it made its way over to IRE. So to sort of close out the claim dispute, there's a couple automated tasks that need to happen. We need to send a UR update. So this is sort of updating information in other systems. This is meant to represent how we may need to update payment structures in other systems or communicate to other external entities. And so we can, again, do that in an automated fashion and still feed that information back to the claim dispute. And then in turn, because the decision did change once again, we will need to send an additional letter to that member to notify them that it was overturned and their claim will be approved, as well as to the provider as well. And then just formally notifying IRE one more time as a part of closing out that claim dispute process. Now that we've followed the claim dispute through its entire process, the last thing that I'll leave you with here is we've got our appeals overview dashboard. So within ServiceNow, we've got powerful performance analytics and reporting. And so because of this, we have the ability to take all of that information that we were viewing earlier throughout that process to feed into some of the details that you're seeing here. So we can see and determine what our average processing time is in terms of days. We can see what our denial rate percentage is from year to date. We can also see where we're receiving these appeals by source. So do we have providers primarily calling in or members as well? What are these appeals by? Is it Medicaid, Medicare? We can see what intake methods. So this also helps us determine what channels we need to be really attentive to. So whether that be via chat, via portal, via call, we want to have visibility into those details as well. And then, of course, the category percentage. Are we receiving a lot of appeals pre-service or post-service? And that also helps us determine, which process we need to really refine and take a look at and continually improve within ServiceNow as well as a part of that process, the visualization that we saw earlier. So with that, that closes out the ServiceNow portion of the live demonstration. I'll go ahead and turn it back over to the team.
Yeah, so a lot to cover there, Jasmine, right? So hopefully, for our audience, just a healthy respect, although obviously they're from this field, right? Just how complex everything, both in the front and back office, can quickly get. And again, we're dealing with people's healthcare, right? So it's going to be a very sensitive topic, which is why, again, there's still a very high likelihood that individuals are going to call, whether it's the patient, the member, and so forth. And certainly to do so when there's a dispute in mind. So if we were to take a look at some of the key takeaways, right, just to close out, because I know we're coming up at the top of the hour here for today's session, a couple of things to maybe, let our audience leave us with, which is first and foremost, you cannot affect, front office engagements without making sure that your contact center, initiative is firmly tied to and woven into the workflows that you presumably plan to or have built on ServiceNow. And when it comes to the preferred form of engagement, obviously voice being the dominant form, both in healthcare, but also just in our everyday lives, you want to make sure that it's a solution that is, there to help solve people's problems, not necessarily used as a stall tactic. And so how can you use voice AI agents the way in which Josh displayed to really leverage and integrate with the ServiceNow data to handle those routine requests, even if it's to, one, get an update, but two, submit a dispute, and do so in an intelligent fashion that either helps quickly get those disputes into the workflow that Jasmine so eloquently walked us through, or, which we didn't have time to showcase today, maybe escalate it to a live agent who will receive that call with all the context within the ServiceNow workspace to be able to hopefully quickly triage live that conversation, that dispute as it happens. But obviously there's other things at play, right, Jasmine? So walk us through a few of these other takeaways.
Awesome. So, of course, we want to have the optimized, customer experience. So making sure that we're not only connecting those frontline experiences with the middle and back office as we showed, but being able to optimize the outcomes and resolution times. So just like you saw in the playbook, being able to connect to other middle and back office areas, as well as even external entities, and funnel that all back to the original claim dispute. So we have full visibility into that, and we're able to quickly dial down those resolution times in something that could be so time sensitive.
And then another, of course, is just how do you streamline compliance and quality assurance? So, one of the things that a lot of organizations struggle with is having visibility into the conversations that actually occurred. Now, in this case, you now have two types of conversations. You have those that are AI driven, so you're literally talking with bots, and then you have those that may be, with a live individual or a combination of the two, right? So one of the things that we can add to the equation is use real-time transcription, sentiment, and interaction logging together with ServiceNow to streamline visibility. So you can either in real time know what's the quality of the engagements that are happening, whether it's with a voice bot, with an individual, or a combination of the two, but also have that historical access, whether it's for coaching, for compliance purposes, for insights, so that you have the opportunity to improve that customer experience, that patient experience, that member experience, so that in the future you can refine your processes and maybe improve the speed of resolution or the types of use cases that you can help solve, right? And then I think the last one really is for you, Jasmine, as well, which is everything that contributes to enhanced agent performance. Walk us through that a little bit.
Yeah. So from an enhanced agent performance perspective, making sure that not only do you have the AI assisted tools, but also automation tools in order to boost that productivity and make sure that you have a single consistency within the workspace. So everything from document intelligence to automatically, identify details within a document that are necessary for, informing the process, to, a visual representation of the workflow you need to walk through, to a data model that has all of the contextual information you would need, and even digitizing forms, having dynamic digital forms that would normally be paperwork you'd fill out as a part of a process, let ServiceNow handle that. And then, in turn, email or send the document outside of the system wherever it needs to go. But yeah, just making sure that we have all the tools under our belt as an agent to be able to perform, at our most productive.
All right. Well, we certainly covered an enormous amount of information. Hopefully, for those of you that took the time to attend today, or those that are watching this session on demand, can quickly understand where the power comes from being able to, not only leverage ServiceNow, but weave in, powerful voice and contact center use cases to maximize that investment and ultimately improve, the experiences that you deliver, as well as streamline the operations that help deliver those experiences in the background. For those of you that are joining us for the first time and aren't familiar with 3C Logic, just a quick little about us. We are the one of the leading contact center voice AI providers within the ServiceNow ecosystem, as the only advanced platform contact center technology and build partner for ServiceNow. And while today we focus predominantly on voice AI and that capability in relation to ServiceNow Healthcare and Life Sciences product, we provide the entire gamut when it comes to AI and automation, intelligent interactions and workflows, traditionally IVR, SMS, sentiment, analytics, even secure payment processing, which I know, of course, is another use case within the healthcare environment. If anything that we covered today, whether myself or our counterpart at ServiceNow, Jasmine, piqued your interest, or you have questions that you'd like to explore in terms of how what some of we covered could potentially be applicable to you in your operations today, we welcome an opportunity to have a conversation with you. Feel free to reach out to us. You can always email us at servicenow@3clogic.com. That's servicenow@3clogic.com. And of course, we'll gladly have a conversation and explore your specific examples, use cases, challenges, and where appropriate, include, of course, our counterparts at ServiceNow, so that we can together offer you a comprehensive solution, as opposed to one that just solves one piece of the puzzle, as opposed to two sides of the same coin when it comes to customer experience. With that, I don't think we have enough time for any Q&A, but want to thank again all of our attendees. Thank you, Jasmine, for your time and contribution today, and Josh for the live demonstration. Again, for all those of you who have joined us for the first time, or perhaps this is one of many, we will continue to have these types of sessions in the future. So stay with us. Take a look at our calendar. We'll have way more events planned for the remainder of the year into the fall and winter, and we hope to see you then. Thanks again on behalf of the 3C Logic team, and to all of you, have a great afternoon.